Good afternoon, everyone, and thank you for joining our session on effective studying techniques. We encourage you to send in any of your questions in the Q&A tab on the right-hand sidebar to be addressed toward the end of the session, if time permits. Without further ado, I would now like to hand this over to nurse practitioner student Sandra Wong. Please send her a warm welcome in the chat.
Hi, everyone. Thank you guys so much for tuning in. So I just wanted to start off by introducing myself. I'm Sandra. I'm a nurse practitioner student. I graduated with my master's in public health, and I also worked in a lot of different fields of healthcare for many years. So I worked as a medical scribe to like a medical assistant. So I have been in your shoes. So feel free to let me know in the chat if you have any questions. So some of my hobbies, like when I'm not studying, is that I love to interior decorate and I love traveling. I'm also trilingual. I can speak English, Burmese, and Chinese. So starting with today's presentation, so the first thing I'm going to talk about is getting your brain in the game. So what I mean is when you're in nursing school, it's so tough because you're going through so much. So sometimes it's important to make sure to take a deep breath before your exams. So what I like to do is this exercise where you just inhale through your nose for 2 seconds and you hold your breath for 1 and you breathe out your mouth slowly for 4 seconds. I really find that doing this helps me just reset myself and do well on exams because I'm not so nervous. Also, not drinking so much coffee helps too. So another thing that I recommend for those of you who are in nursing school or you're about to start is to filter your social media accounts that do not bring joy. So that means maybe going through who you're following. If you feel like it makes you feel a certain way that may not be positive, it's important to think about it and maybe follow accounts that promote health and positivity and wellness. Also, finding your health mantra. So I have a mantra right here that I like to read. Positive affirmations really help in nursing school because when you're going through a tough time, just reiterating things in a positive way, practicing something like this where it's I invest my time and energy in what feels right for me, or there's space for me to grow. Just having positive affirmations really allows you to have a positive mindset. And I feel that's so important in nursing school because you're going through so much tests, so much anxiety. So keeping a positive mind. And another thing is to make sure to repeat to yourself, you are enough, you can do hard things because you got into nursing school. Okay, so I want to share with you guys this really awesome motivating message by Oprah Winfrey. So we're going to play for you right now.
Such thing as failure. Failure is just life trying to move us in another direction. Now, when you're down there in the hole, it looks like failure. So this past year, I had to spoon feed those words to myself. Here's the key. Learn from every mistake. Because every experience, encounter, and particularly your mistakes are there to teach you and force you into being more of who you are.
That is a little something.
And then figure out.
If you guys feel motivated, whatever you do, whether it's nursing school or just anything in life, just making sure to continue to believe in yourself when times get tough is so important. Okay, so next we have, is nursing school hard? What do you guys think? Let me know in the chat if you guys are in nursing school or you're about to start, how do you feel about it? So yes, nursing school is hard, but you can do it. You can do hard things. You already have done hard things. So what makes nursing school hard? So it makes your life hard because you have to juggle a lot of things. Maybe you have to juggle family or you're working and also all the nursing school exams. It can get overwhelming at times, but it's doable. Nursing school concepts are hard, but they're not too hard to digest. With a lot of practice and repetition, you can do it. So I really like to use Picmonic and TrueLearn. I have been using it for so many years, and I totally live by Picmonic and TrueLearn. So yes, it can be broken down to digestive bits of information because they have a lot of amazing mnemonics that allows you to just retain the info really well. Okay, so we're going to do a little quick poll if you guys want to participate. So how many of you guys are a nursing student? Let's see in the poll. Yes. Thank you guys for answering. 2 votes, 4 votes, 5 votes. So many of you guys are nursing students and maybe you guys just started. So I know how you guys feel. So I'm so glad you attended this session so I can give you some tips on how to do well. All right, so next slide. So how to organize your semester. So your new best friend is a planner. I am not gonna lie, having a planner is like everything because you can write down everything, and when you have so much in your head, it's important to write it down because it takes that stress off of your mental state, and it just relieves a lot of anxiety. So find an easy planner. I like RecMed because it's like a nursing planner that is just dedicated to nursing students, and it has like different cute components where you can put what classes you're taking to organize it, or maybe like your upcoming tests. So I really like that planner. So yeah, write it all down. Everything like your birthdays are important to you, tests and quizzes. Do you know how to organize your time in time blocks? And write down your tasks each day. So what I like to do is to have 5 tasks a day. I don't do anything more because sometimes when you have a long list, it's really hard to cross everything off and you just kind of overwhelm yourself. So just sticking to 5 important tasks a day will help a lot. So cross it off when you're done. You'll feel so amazing when you do it. Rest and prioritize. Yes, I'll write the name of the planner in the chat. It looks like that, RecMed right there. But let me write it right here. Not sponsored or anything, but I really like it. Okay, so another thing is to start healthy habits. So find a good carb and protein snack. Prepare meals, make sure to not skip meals. So I don't know about you guys, but I get hangry when I don't eat. So I have this funny quote right here. A state of anger caused by a lack of food, hunger causing a negative change in emotional state. So how many of you guys have been hangry? When you just skip a meal and you can't really think straight. So it's so important in nursing school to make sure to take some time to meal prep, and it also saves money. You can just go to Costco and buy the microwavable foods and just microwave it, meal prep it in boxes. So that will save you a lot of money. And yes, Anna, I will definitely put that in the chat too. I'll put it after the presentation. So another thing that's really important in nursing school is to make sure to sleep. So maybe many of us take sleep for granted. I know I do sometimes, but sleep really helps your body become less stressed. So you can think better on exams when you have at least 7 to 9 hours of sleep, because when you don't sleep, you start to work even harder to try to focus during the exam. So yeah, so sometimes it may be hard to choose to prioritize sleep over maybe staying up studying for that test that you didn't study enough. But I highly recommend maybe just calling it a night and saying it's 9 p.m. I'm gonna sleep. I'm gonna wake up at 3 a.m. to study, or even creating a 5 a.m. study routine when it's just the sun is rising and you have some time to just wake up, have your morning routine, and everything is quiet. It's really nice. So also how to logic through things to keep patient safe questions for nursing. So what I mean is by having adequate amount of sleep, this allows you to think, better on your exams, because a lot of the nursing questions are nursing safety exams, and even in clinicals, you have to have enough sleep to make sure that, you're thinking real sharp. So how to stay motivated. This is one of the most popular questions that I get. So I always live by this. Remember your purpose. Why did you choose nursing? So showing up also is the hardest part. Sometimes waking up super early, but you have to remember why you chose to be in healthcare. And I feel just remembering that each day when you wake up can really help you go through times where it's so difficult. So at one point, you were super thrilled to get into nursing school, so remember that day. Keep that card from that kid at clinical. For me, one of my clinicals before I was in a psych rotation, this little cute girl gave me a drawing, and I kept it forever, and that just gave me that reminder I needed, like, this is why I love what I do. You're helping somebody, you're making a difference in their life. And yeah, just little things like that. So make sure to keep it. So things like that helps you keep going for days you're exhausted. Print out your student loans and put it on your wall. I don't know about you guys. I know this can sound crazy, but like, if you put your student loans on your wall, you got to pay that back. So if you find that as a way to motivate you to do well, what works for you, right? Okay, so identifying the best learning modalities for you. So it's important to know yourself and know your study habits. So work with your brain instead of fighting it. And also watch video formats, listen to lecture, write notes, and read. So what I mean by this is that how to succeed in nursing school is accumulation of a lot of things. It's not just one thing. You have to make sure to watch videos and retain information from there, practice it, and also listen to lectures. Maybe when you're driving, maybe you're like in the shower, you can play it. So a lot of repetition can help like ease the concept in your mind and understand it better. And for those of you who likes to write notes, that works too. What I like to do is write out like the important parts of like each PowerPoint presentation. And then I just like take notes during class and just highlight them in like a different color, like red. So find images related to the topic. Find an audio version and take more notes. So podcasts, there's a lot of great podcasts out there in nursing concepts. So like, let's say you're going through pharmacology, you can look up a simple nursing podcast and just like listen to the pharmacology medications over and over, and that really can help you. And so yeah, the key is to get familiar with the topic because there's no wrong recipe. So it's just a lot of trial and error. And here's a picture of Picmonic. I'm sure you guys have it already. Okay, so how to stay focused. You guys know turning off your cell phone and putting it in another room when you're studying is like key. I don't know about you guys, but you're going to get that text while you're studying. It's going to like deter you from what you're learning. So it's important to maybe just put it on silent or just put it in another room for like your time block of studying. But yeah, also like make sure to take breaks when you're studying. I like to use the Pomodoro method. So maybe you study for like 25 minutes straight. You can get up and walk for like 5 minutes. I like to walk because you're getting that energy in you again instead of just staying stagnant. That really helps like activate your brain more and just leaves you more refreshed. So yeah, hide the dopamine machine. That's your cell phone. Maybe Instagram or TikTok. Okay, so clinical tips. So the more you see and do builds more confidence, especially true in a clinical setting. I do really feel like I learn a lot more in clinical because you're practicing everything in real time, and also by doing things, you're able to get better and be more successful at it. And being book smart is one thing, but learning things in the clinical setting it's even more rewarding and fulfilling because not only do you get to interact with your patients, but you're working with your nurses and you're learning so much, and it's an amazing experience. And yes, Karina, cell phone domino effect. Maybe you're on Instagram, then you go to TikTok, and now there's like YouTube Lemonade. So I know how you feel. So yeah, clinical tips is practice, practice, practice. So, I feel like many times many of us are really hard on ourselves. And we're like maybe scared to try new things, but when you do it over and over and you practice, you get better. And also acknowledging yourself that you are doing hard things and that you can do it, I feel like that can help you go through difficult things in life because fear is expected, and the clinical goal is to show up and your willingness to learn. So one of my favorite quotes that I always keep in mind whenever I'm going through so much schooling. I've been in school like my whole 20s, so I understand. So do the thing you fear to do and keep on doing it. That is the quickest and surest way to ever yet discover to conquer fear. So you guys, you got this. Conquer your fear. You're going to get through it. And let me know if you guys have any questions. I'm like reading it while I'm doing the presentation. So thank you guys for participating. So favorite tips for studying and taking nursing exams. So write the safety implications for the topics. So what I learned that allowed me to do really well in nursing school is to know like what are the nursing safety for this concept or the nursing interventions? What would the nurse do? And like, do you assign this to the nursing assistant? What do they do that's different from the RN? A lot of the questions are really nursing safety. So like, for example, does a blood pressure medication lower BP? What would the patient look like if the patient experiences side effects? What is a normal blood pressure for this patient? How do you know if the patient should hold a med? So these are kind of like some of the questions you're going to see on your exams, and just knowing the concept and knowing the nursing interventions can really help you guys do well. So turn it into a safety fun fact. Your brain will start to do it automatically with time. So as you guys progress through your nursing school studies, you're going to notice that it's going to get easier because you understand what it's going to ask you. It's probably NCLEX style questions, of course, and more practice makes perfect. I just want to see Cecilia's comment. Yeah. Yes, Picmonic all the way, you guys. So identify the concept is the answer relating to the question asked. So one of the tricks that I learned from my professor is that when you are looking at the question and the answer, does this, like it says A, B, C, D, right? So look at the answer and see, does that answer even relate to the question? If it doesn't, it's probably not the right answer. So check and see if that answer correlates to that concept in the question, and that can kind of help narrow down your answers. Also, another thing that I learned is for the select all that apply questions, you know, like maybe the 5 or 6 boxed, like where you like check it, you know, for the select all that apply. I know it can be scary because it is for me too. But what I learned is maybe check and see, like, is that a true or false statement? If it's false, don't select it. You know, if it's true, select it. So that kind of helps narrow down the answers when you are taking these like scary true or false questions for like the select all apply with, like, you know, all those boxes. I don't know about you guys, but that's how I feel. Okay, so another thing is flashcards. So one of the things that I like to use is Anki. So Anki is awesome because it's like index card you can bring with you. Like maybe you're waiting in line at Starbucks, or you're somewhere maybe with your family and friends, and you can look at the Anki cards and do it. Like, and also it will tell you like, okay, you need to study more on this concept. So it's going to allow you to have spaced repetition, and it keeps bringing up the ones you got wrong, and it shows you the ones that you got right. So it's all about spaced repetition. And there's another motivating quote that I really like to live by. So there is no failure except in not trying. So when you guys go through nursing school, make sure to just remember that it's okay to fail, but you have to keep trying and keep getting back up. So I wanted to do a quick Q&A session. So do you guys have any questions? Let me know in the chat box. But I do have some questions that I received from you guys. I did a Q&A on my Instagram, and I wanted to see like what questions you guys have. So I'm going to pull it up. Okay. So one of the question is, hi, I'm having trouble with studying effectively. I would like some advice and tips to master studying, learning, and retaining information in nursing school. So yes, practicing active recall is so important. So active recall, if you guys haven't heard, is like maybe you are like teaching like a stuffed animal, or you're teaching your dog. Whatever concept that you learn, you have to like say it out loud and try to like teach it in a way where it's easy to understand for the other person. So active recall is like really testing like your knowledge if you understood it, where you can teach somebody else. So going back to that question, some advice on like mastering studying and learning is also spaced repetition. Practicing maybe like 2 hours each day instead of like long time blocks can help you understand the material better. And I see Cecilia's comment, what are Anki flashcards? So Anki flashcards is like a virtual like downloading app you can download on your computer. So you can type in the question. It's kind of like Quizlet, where you like type in the question and you just like answer it. And it shows you like in a bar graph of like how many questions you got wrong on this concept, and it's gonna replay that same question until you get it. So instead of Quizlet, where it's like, okay, you get it wrong, but in Anki, it's going to allow you to go back in there, and it's gonna keep showing up until you get that concept. So yeah, Anki flashcards. I can send a link perhaps after the chat or after this presentation, and I'll make sure you got it. Another question is, let's see, how to answer questions where all the answers are correct, how to not overthink a question, and how to better retain nursing information study tips. So the first question I'm going to answer in this is how to answer questions where all the answers are correct. Usually when you take a nursing exam test, the teacher has two answers that are very closely, that could be right. But I feel like when you look at it, it's important to cross off the ones that maybe doesn't feel like it's correct. And then when you go down to the two, find the answer that is really relating to the question. Like it has nothing, like if you're talking about blood pressure, like if it's talking about like, you know, GI or something, like just cross that one off because it doesn't like relate to the question. So I think just like narrowing down the questions, like when you're taking the answers when you're taking the exams can really help. Okay, so how to not overthink a question. This is a great question because I mean, I feel like I overthink a lot. I think that's just like something most of us goes through. So by not overthinking a question, I feel like is the more you study, the more you feel confident in yourself when you take the exam. So by the time you take the exam, you know that you trust that you did everything that you can. You tried your best, and that's really all you can do. And yeah, so you're just doing your best, and that's important. Okay, so I have some questions here I'm going to read. So Asia said, has anyone found positive benefits from studying with whiteboards? Pros and cons. Honestly, I love this. Whiteboards are amazing. I bought different sizes of whiteboards, but like I think having like a super big whiteboard and just like writing it out and just like pretending like you're teaching someone, or if you can teach like, you know, maybe a family member, that would really help because you're able to practice like active recall. That's active recall right there. I don't really feel like there's any cons to it. Everyone has their own way of studying, and maybe doing a whiteboard and doing active recall can really help. Okay, so Karina said, I like making the flashcards into Kahoot quizzes turning into a game. Yes, and my teacher actually in MedSurg, she did like Jeopardy, so that was really fun. So maybe having like the different concepts, and also like in the Jeopardy game, like having the answers and like pretending like you're winning like certain points, and maybe playing with friends would be really cool.
Sandra, okay. We do have some questions in the tab below. This one, the Q&A tab. A few people have the questions there too.
Okay, I see a few questions here. So from Joy, how do I properly study in the first semester of RN school? I feel like I'm not studying correctly to pass the test, and it's so much information coming at you and being assigned, which is impossible to read it all. Yes, I absolutely agree. I know it can be like really overwhelming, like just reading like all these, you know, chapters, you know, like I remember my MedSurg book was like, ooh, this big. So I think in order to properly study, especially in your first semester when you're taking maybe funds or pharm, I feel like it's important to look at the objectives at each concept. And like for each concept, maybe write down like the important things like, yes, nursing safety questions, nursing interventions. What is the pathophysiology to this? And just really understanding the concept. If you're able to understand the concept, then you're able to maybe, you know, cross off the question, the answers that is not related to the question, and you can just narrow it down to the right answer. And I know, like, yeah, you feel like you're not studying correctly to pass the test. Don't be hard on yourself. Like maybe when you're not doing well on one test, maybe there's like more tests like that you can do well on. Because I know there's like maybe like for patho for me it was like 10 tests. So if you did bad on like one or two, it's okay. Just keep doing good and keep being positive. Because like when you are really hard on yourself, maybe when you're not doing so well on one of the tests, it can really bring you down. But surrounding yourself with like, you know, your nursing buddies and being able to like lift each other up really helps. Also your teachers, you guys. I mean, for me, I felt like when I was going through a hard time, I reached out to my professor, and she was able to spend the time during office hours to explain some of the questions I got wrong and the concepts, and just feeling that rapport with your nursing friends and also your professor can really help. But also tutoring. Don't underestimate tutoring. Even if you feel like you don't need it, it's important to just try to use it, because they have been in your shoes and they probably have like the study guides to like go over what questions that may come up. So hopefully that helped, Joy. Okay, so another one is, if you have 3 exams in 1 week, how do you study and what do you study first? Great question. So there's a saying that if you study the easiest one first, it feels easy. You want to just do something you're comfortable with. But the best thing to do is to study the one that you are not so comfortable with, because there you're able to tackle the hardest one, where you're putting all your energy into this, learning this concept and being more familiar with it over time, like spaced repetition. Like maybe Monday you study this topic that's hard to you, and then on Tuesday you study a little bit more, Wednesday you study a little bit more. And so by that 3rd day, you mastered, or you are more familiar with that topic that you felt that was hard. So I hope that helped. Thank you guys for the kind comments. So how can I find people to study with? I have graduated and there is no one that I can study with. Any apps or things I can go that are legit? Yeah. So honestly, I would either like reach out to your school and see like maybe somebody from another campus, or even for your own campus, like I'm sure there are like clubs. Like I know like for my school, like we have like clubs that are based upon like nursing, like I wouldn't call it sororities or something, but like it's like a group where you are able to balance out school but also like hanging out. So maybe try to find groups or clubs on campus. And, if that doesn't work, sometimes maybe reaching out to a friend that is at another nursing school and just being like, hey, do you want to study? Or just like having a buddy to study with. I feel like that can help you, so you don't always feel alone. Or just going to like bookstores. I like to go to like Barnes and Noble and just like study there, and just to feel like you're around people. Okay, so let's see. Yeah, what are Anki flashcards? Yes, so yeah, those are the flashcards where you can just download it on your computer. You can have it on your tablet and your phone. So those are really useful things. Okay, let's see if there's any more questions. All right, so let's see. Okay. Yes, Barnes and Noble. I mean, yeah, especially with it being the fall time, it's super cute. So Starbucks, Barnes and Noble, the library. So like, I think another thing that I want to share with you guys is if you feel like you're studying at home and you just like are not retaining the information, change your environment. So maybe that means going to like Starbucks or the library, and giving that different stimulation to your brain can really help you like feel like, okay, you want to like tackle this topic, you want to tackle this concept. So just changing your environment, can really help. Or maybe doing like a 30-minute walk on the treadmill. I mean, sometimes I have to read my PowerPoint slides while I'm on the treadmill. So, I mean, do what works for you guys. But I really hope that this helped you guys. Feel free to, message me on Instagram or, on TikTok. I'm on social media. And if you want, you can also email me. But I really appreciate your time. I know you guys could be doing anything in the world, but you're choosing this. So prioritize yourself and your career. And yeah, you guys can do it. I'm going to share the screen back to Ariel.
All right. Thank you so much, Sandra. And thank you everyone for joining us. Please feel free to send any of your additional questions to webinars@truelearn.com, and we will get those answered for you.